Okay, hello and welcome to this webinar. My name is Alistair Brown. I'm the Editor-in-Chief of the Lancet Planetary Health, and I'll be one of the facilitators for this discussion. The theme is Spotlight and Health. Is health and climate change, and the specific focus is around integrative research. And we've got a fantastic panel going to talk about their experiences in carrying out and disseminating integrative research projects. Can you next slide, please? So just quickly go into a bit of housekeeping. So attendees are welcome to submit questions throughout the presentation. Use the Ask a Question box on the dashboard. On the webinar dashboard, you'll see a box with related Lancet 200 resources, and there's a link to Spotlight and Health climate change content you can explore. You can adjust or minimize any of the boxes that appear on the webinar dashboard to suit your preferences. A link to the on-demand version of the webinar will be emailed to all once the webinar is concluded. And once the webinar has ended, please complete our 30-second feedback survey so we can improve future offers. Okay, so climate change is profoundly inconvenient. And if you don't think so, you probably haven't thought it through sufficiently yet. One of the central challenges is that we cannot hope to address climate change through siloed, isolated thinking, or research or policy or practice. And addressing climate change and other major and related challenges facing society, such as social injustice and biodiversity loss, requires much more joined up thinking and working than we conventionally employ. This is easy to say, but it's often harder to deliver, particularly in a mostly very siloed wider context. Integrative approaches to research and policy, those that progress us towards more fully integrated ways of thinking and strive to address interrelated challenges, to minimize trade-offs and antagonisms, while also finding synergies. Delivering on this idea, however, requires new skills and capacities to navigate often daunting complexity while avoiding unhelpful abstraction and simplification. Furthermore, there are many habitual, historical, and institutional factors which make working with colleagues from different intellectual traditions and orientations challenging in practice. So this webinar is profiling our excellent panelists and their experience across a range of integrative projects, learning about the barriers and enablers they found along the way, as well as some of the benefits and challenges of designing integrative research processes and outputs to inform policy and practice. And there'll be a Q&A session to finish, as I've already mentioned. So I'll just briefly introduce the panel, and then we'll jump into hearing from them about their expertise. So I'll start with introducing Donald Warne. Donald co-directs the Centre for Indigenous Health at Johns Hopkins University, where he is also full professor and provost fellow for Indigenous Health Policy. Previously at the University of North Dakota School of Medicine and Health Sciences, he was Associate Dean for Diversity, Equity and Inclusion, Director of the Indians into Medicine Program and Director of the Public Health Program, as well as Professor of Family Medicine. At the University of North Dakota, he developed the world's first PhD program in Indigenous health. Dr. Warne is a member of the Oglala Lakota tribe from Pine Ridge, South Dakota. Next, I'd like to introduce Adetoun Mustafa. Adetoun is a leading environmental epidemiologist in Africa, an adjunct associate professor at Lead City University, Nigeria, and adjunct research fellow at the Nigerian Institute for Medical Research. Her research is focused on air pollution epidemiology and respiratory health, social determinants of health, built environment and climate change, particularly as it pertains to maternal and child health. She has a wealth of expertise in managing research in low and middle income contexts and engaging in public health advocacy to influence global research agendas and policy interventions. Next, Anna Stewart Ibarra. Anna is the Executive Director of the Inter-American Institute for Global Change Research, and she's an expert on climate and health in Latin America and the Caribbean. She was formerly the Director of the Latin American and Caribbean Research Program of the Institute of Global Health and Translational Science at the State University of New York, Upstate Medical University. Her research is focused on understanding climate, environment, and social drivers of vector-borne diseases and other dimensions of human well-being in Latin America and the Caribbean. Next, I'd like to introduce Renzo Ginto, who's Associate Professor of Global Public Health and inaugural Director of the Planetary and Global Health Program at St. Luke's Medical Center, College of Medicine in the Philippines. He's a member of the National Panel of Technical Experts of the Philippines Climate Change Commission and convener of Planetary Health Philippines. I think it's fair to say Renzo is a particularly vocal and passionate advocate for planetary health more broadly. Next, I'd like to introduce Manushi Sharma. Manushi is a research fellow at the George Institute for Global Health in India. She's an adaptive learning and evaluation specialist. She's from the Himalayan region of Uttarakhand, where she experienced challenging stemming from inadequate access to health and poor governance of natural resources. This motivated her to explore innovative, integrative approaches that target complex problems. She has over 10 years of experience in the Asia-Pacific region. She's collaborated with academics, governments, and communities in the region and conducted participatory research to inform health financing and system strengthening. And then last but not least, I'd like to introduce my co-host, Margot Parks. Margot is originally from New Zealand, is professor in the UMBC School of Health Sciences, cross-appointment in the Northern Medical Programme. She prioritised working and learning with others across regions, cultural contexts, disciplines and sectors to foster better understanding of land, water and living systems, ecosystems, as foundational for health, equity and well-being, and to strengthen collaborations that reflect these connections. Her research is focused on integrative, partnered and Indigenous-informed approaches, especially those that connect social and ecological influences on health within watersheds and in rural, remote and Indigenous communities. So that's our excellent panel, and I won't take up any more of your time with my voice. I'm going to pass over to Margot, who's going to kick us off with the first question to ask the panel.
Thanks, Alistair. It's a real pleasure to be here with this inspiring panel of integrative researchers and such a rich array of experience across diverse contexts and backgrounds. The first question that we're going to ask our panelists is about their experiences from their context and some of how we can understand the key opportunities and the key barriers and enablers you've found along the way as you've been establishing your trajectory in this important area. Donald, it's an honour to be beginning this panel with your expertise from another part of Turtle Island. And a reminder that because of our time constraints, we'll just be flagging for everybody when you've got 30 seconds to go on your brief contributions. So over to you, Donald.
Hello, thank you and welcome to all my relations who are part of this important discussion. Again, I'm Donald Warren. I'm Oglala Lakota, originally from Kyle, South Dakota on the Pine Ridge Indian Reservation. And I work as a physician and researcher and administrator, but I'm also from a family of traditional healers in the Lakota ways of knowing and cultural perspective. And I come to this work in addressing climate change and health really out of necessity based on the pervasive impact of climate change on all human beings, but particularly for Indigenous peoples. So in my work and in my context, I've been focused on Indigenous health for the last 3 decades. And it's important to recognize that there's a great deal of diversity among Indigenous populations. So I've worked primarily with American Indian and Alaska Native populations in the US, but have done some international work as well. And when we look internationally, the Indigenous peoples, or the first peoples of various parts of the globe, constitute about 6% of the overall population, but about 80% of the world's biodiversity is being stewarded by Indigenous peoples. So that's an important context to recognize the importance of the population in looking at the impact of climate change and health. And from my perspective and my context, we have to look at this in a very holistic way. Obviously, there are physical impacts of climate change, but there's also spiritual and cultural impact, mental health and emotional health impact. And some of my colleagues in Alaska have been looking at this issue from the perspective of climate grief and actually a grieving process for the tremendous changes that have occurred. So when I think about what's happening, at least in the US for Indigenous populations, we have significant changes due to things like global warming, but also droughts and fires and floods and other challenges to the Indigenous landscape and the ecosystem. So in a very basic way, it's had a huge impact on our food systems. We still have a lot of populations that are subsistence cultures and communities, and they rely on the natural world for existence. I was just in Alaska a couple of months ago, and it's remarkable how much has changed, the loss of sea ice and how so many parts of the ecosystem are dependent on that sea ice, and including the humans who then hunt the animals and fish And some of the streams, they've seen just remarkable reductions in the salmon that used to swim upstream into where the villages are located. So it's had a huge direct impact, obviously, from a physical perspective, but also from a cultural and spiritual perspective. There's a deep-rooted cultural and spiritual connectedness to the natural world. So when we look at research approaches, we have to recognize that we need to be holistic in our research approach. We can't just look at the silos that we have historically to understand the true impact of climate change on indigenous peoples as well as worldwide. The other perspective is that as indigenous,
warning, Donald.
Yeah, and as indigenous peoples, we have a lot of value and expertise to add to this discussion in terms of respecting the earth and viewing the earth as a partner in promoting the health of our people. So I'm excited about the movement toward planetary health, and obviously having an indigenous focus on planetary health is a key part of our solutions moving forward. So thank you very much.
Such an important perspective to start off this panel, recognizing that integrative approaches have such a long history with Indigenous knowledges. Thanks, Donald. Anna, we're really looking forward to hearing from your perspective on your experiences around your approaching integrative research. Over to you, Anna.
Thank you. Briefly, the organization that I serve, the IAI, we're an intergovernmental organization with 19 member states of the Americas, and our mission is to support the production and use of science information on global change processes so that our countries are better able to design and implement policies. So our research agenda is wholly focused on transdisciplinary research. Important for the conversation today, our governments have identified climate action as the most important global change issue and health as the most important emerging issue. So in response, we have been working to mobilize a regional research and policy agenda on climate, environment, and health in the Americas with leaders from national and intergovernmental agencies. And these efforts have been purposefully aligned with a global funding call on the nexus of climate, environment, and health under the Belmont Forum. And we knew that it was critically important to invest in raising the issue on the political agenda, training and network building before launching the call, if we really wanted to change the profile and encourage new and early career investigators from countries with limited research capacity to be able to competitively access this research funding. And so to do this, we worked with PAHO, the WMO, and other partners to do a series of live virtual courses led by experts from the region for the region, primarily in Spanish, also with interpretation available. And the response was overwhelming. We had over 3,000 people register for the first course and about 1,000 people connected live for most sessions. And we then followed this by launching a targeted training program to strengthen transdisciplinary teams from the Americas. And each team included at least one social scientist, one biophysical scientist, and one team member from outside of academia, be it civil society, government, or the private sector. And the teams had to come to this program with an idea that they would develop into a research proposal for funding. But importantly, the projects had to be linked to the critical needs of the health sector. As the teams developed their projects, they received close mentorship, and they merged with other teams to create multinational teams to address these trans-boundary issues. So today, we are in the process of funding 12 projects with participants from 15 countries. 10 of the 12 PIs are women, and 1/3 are early career investigators. And these projects will be implemented over the next 12 to 18 months, providing critical evidence to inform health sector adaptation to climate change. One key outcome was a legislative declaration from the province of Neuquén, Argentina, in Patagonia, committing to research and policy action at the nexus of climate, environment, and health. So in concluding these initial comments, I want to highlight the importance of engaging with and supporting the robust existing networks in Latin America and the Caribbean and other parts of the global South already working on climate and health action, and the importance of strengthening and supporting these efforts rather than reinventing the wheel.
And that's a 22nd warning, Anna.
I want to highlight the importance of language, providing multilingual training, network, and funding opportunities from the local experts is of critical importance if we want to increase the participation and leadership of the Global South in this critical discussion. Thank you.
Inspiring stuff, Anna. Thanks so much for, I really appreciate the emphasis on this boundary crossing capacity strengthening, which is such an important part of this work. Thanks so much. I'm really happy now to be moving on to our next speaker, Renzo. Looking forward to hearing your reflections on this challenge.
Thank you very much for having me here. So let me begin by describing myself, what I do, what's my work. And I always describe myself as a planetary health academic. I know planetary health is already a complex integrative concept, and I'm adding a new term to your glossary that also reflects integration. Because if we are talking about integrative research, we must start from within the researcher, within us, one foot standing on academia and another in the world of practice. And in the past, 3 years, we were privileged in the Philippines to establish a planetary health group, not in a university, but in a 30-year-old medical school that is attached to a 120-year-old hospital. And we built it in a middle-income Southeast Asian country at the heart of the climate crisis, because the Philippines, unfortunately, is always ranked as one of the top 10 countries in the world when it comes to climate risk. And so we're already, in fact, facing the impacts. It's imperative for us to act on these challenges. And I already mentioned that we're not in a university, so that's already a major challenge to integrative research. There are disciplines that do not exist, and we need to think of creative ways of bringing the disciplines to our medical school, working with colleagues from other universities, for example, but also building the team, the transdisciplinary team from within. And I think that is the beginning of integration. So I mentioned the integration within the self, for example, as a principal investigator, and then the integration of disciplines and even generations within your team. As you can see in these photos, we're a very young planetary health transdisciplinary team. More than half of my team do not have MDs, and we are based in a medical school. So that just speaks about the importance of, again, being intentional in assembling the right team in order to implement integrative research. And also another way by which integration can manifest in our work is by integrating ourselves into the community with the community. It's not the other way around, that we incorporate community perspectives. That is always what we say in our proposals or in our presentations, but we are the ones who should be going to the communities. These are just some photos that show to you how we are doing the work towards building climate resilient local health systems, not on our desks, not inside our labs in the ivory tower of academia, but in the community. Communities already facing sea level rise. Communities affected
20-second warning. Thanks.
And many others. And it's also important that we integrate ourselves to the policy process of the country and of the world. Right now, we're finishing the National Adaptation Plan of the Philippines, and our local work is very much integrated to the national and global work. I'll stop there for now. Thank you.
Thanks so much, Renzo. It's so difficult to cut off these stories of, but really memorable personal and professional approaches to being an integrative academic. Thanks for the new vocabulary too. We're now really looking forward to hearing from Aritun. Over to you.
Thank you for having me. I'm an environmental epidemiologist and I'm based in Nigeria. And I'm going to put on the lens of a low and medium income country into this discussion. One of the challenges you find out in our current day practice in health is that there is no longer the issue of one exposure causes one health outcome. The causal pathway for most diseases are numerous and they are interconnected: biological, social, environment, and even behavioral. So if you want to solve an health problem, which is what my discipline aims to do, and especially for the impact of climate change on health, integrative research is very important. But the challenges are also numerous and the barriers. One of the challenges you will find in my part of the world is the Western gaze is used to define research priorities for climate change. But for us in Global South, the starting point when you talk about even climate change and health, they are different. 2.4 billion people are using biomass for cooking and eating. a third of them come from low and medium income countries. The priority is actually, and a lot of household pollution and air pollution and ill health are resulting from this. So the priorities are many. The first thing is even to stop people from falling down trees and using it for cooking. What do we provide for them in the short term to be able to, before they move on into using electricity to cook? How do we move them from biomass into a cleaner fuel? Before you even talk about the impact of them, of maybe using another fuel type or is having on their health. So I think defining one of the barriers in integrative research is even conceptualizing what is the problem, because our starting points from a different parts of the world are different. And then getting the right fund for us to come to a term that we all agree that this is the problem, communicating the problem and agreeing the research methodology, it takes time. And then the kind of study we will do will take time. It is often difficult getting funding for a lengthy research that you will need to do in an integrative research manner. So looking at the issue of what is the problem from my part of the world and getting funding to engage, to get the community to be part of even the research we are doing, people that will be impacted by it, and to get into the level of where we will communicate in a language they understand. All this takes time, and oftentimes because the funding is not available.
There's a 20-second warning.
Global South, then it becomes an issue. Who fund integrative research that the starting point is different from what you have in the global north? Thank you.
Thanks so much, Adeton. I'm so glad you were emphasizing this theme around the different power dynamics and priorities and starting points from your perspective, and the courage to do work that's foregrounding community knowledges. Thank you very much. We're now going to finish our first lap of the panel, and Manushi, thanks for coming in with your perspectives on challenges and enablers of integrative work.
Thank you, Margot. I'll start by introducing myself. I'm a pharmacist with experience in health program and policy evaluations. And I also bring the perspective from a highly vulnerable, less spoken, the Himalayan region. And that's also the reason why I segued myself into this integrative research area. And to start off, I would like to share a story about, I'm sure many of us have heard the parable about the blind men and the elephant. And there's a group of blind men that come across this elephant and they want to know what it is. So they start by exploring, by touching different parts of the elephant, and then they describe the elephant through their limited experience. And that, when I bring it to systems thinking, is the type of work I do. That exactly is the challenge that I am facing in my work, where we have so many brilliant people working on different parts of the system, describing the challenges in their own limited experience and their own ways, which are sometimes biased, sometimes they don't extend beyond that silo that they have created for themselves. In my work in evaluations and adaptive learning, I've also encountered how narrowly impact is defined, and that gets a lot of challenge. That is a big challenge because, in this complex system, how can you count causal linkages? How can you ensure that, action A causes this? This is the traditional type of thinking. And more when I explored the causes, in systems thinking, I feel there are two main challenges. The way our systems are organized are very siloed. Health ministry might have ambitious plans. Some health policies that I've reviewed, especially from my state, Uttarakhand, they've started recognizing that environmental challenges exist and climate change will bring on more challenges. But when I connected with the resource allocation, there are no funding mechanisms to actually mobilize these integrative interventions. And unfortunately for us in the Global South, our view of development is very heavily GDP driven, and this dominates the resource allocation strategies. The second thing I feel as from the public health community as a pharmacist, that our research is grounded in traditional approaches, and it is very non-systems oriented. Like multi-level systems are often seen as a nuisance and not as ways that provide you valuable context. And more so, we need these approaches because if we want to hear from communities in the region, for example, like how one of the speakers was saying about, community mobilization, community engagement has become a buzzword. I think using participatory action approaches to move beyond what we have already, especially engaging with the youth. In one of the studies on water, sanitation, and hygiene that I was a part of, we engaged with the youth in the neighborhood to identify what are the wash risks that they face. And this was
It's
in
a 10-second warning, Manishi. Thank you.
In a low-income area. And so I'll conclude on the note that we need more participatory approaches that enable us a systems-wide inquiry. That's it.
Thanks. What a lot of ideas have come through in this panel, Manushi. The fact that you started with that parable, it reminds us how long these barriers have been there, but all of you have been underscoring the kinds of pathways to overcome them. And I really appreciate the emphasis there on participatory approaches and youth and different generational engagement. So lots to pick up on. I'll now hand over to Alistair to continue the next round of questions. And fortunately, we get to hear from this inspiring panel again a few times. So over to you, Alistair.
Thank you very much. And thanks ever so much for all of that rich experience that you shared with us. So now we've discussed a little bit about some of the reasons why we need interdisciplinary or integrative research, some of the kind of challenges of getting that off the ground and running those projects. Now I'd like to invite you to reflect on your experiences of what happens when these kind of integrative research hits the road, if you like, and hits the wider world. So once you've developed these integrative research outputs, how are they is it challenging to get it published? Is it challenging? Is it difficult to progress careers? Are there challenges hitting policy, or on the contrary, is it helping to get published or helping to have direct policy influence? So yeah, if you could reflect on your experiences of the research output and how effectively that influences the wider world, that would be fantastic. And I'd like to start with Adetoun, please.
I started my career as an environmental scientist, and I was a supervisor for a waste management facility, and we were trying to build a landfill site, and it was difficult getting anyone to make land available. And I kept advocating the challenges with environment. Those are in the mid-90s. And then I realized that a lot of people were not getting it, and that spurred me to go for Masters in Public Health. I wanted to be able to relate health to impact of environment. And one of the challenges, one of the reality that came to me was, I did a study on impact of landfill sites on health. I studied in the UK then, and I came back to Nigeria and I wanted to publish my work, my MPH thesis. And the environmental journal, National Environmental Journal I submitted it to, the reviewers sent me their comment. They said, this is not science. It was an environmental epidemiology study. And they sent to me that this is not science. And that recently I was doing also, we were looking at air pollution across Lagos, and we are installing a low-cost sensors and also a passive sampler in homes. And we submitted an ethics application in an institution. And one of the reviewers came back to me and said, you did not specify the biochemical tests you are going to conduct in this. What all these are telling me is that the challenges of publishing multidisciplinary research in journals that are specific on particular discipline or have outlook to what is science is real. And also even get it ethics approval for such study, because some of the ethics institutional review boards do not have all the skills of integrative research in their midst. So these are challenges that are real. Things are changing now. The kind of comments I got in the late 90s are no longer there. Things are improving, but you still have the reality that not the kind of comments that people get when they want to publish integrative research are still there. So there is a need for education and openness.
Sorry, can I cut you off there? I'm afraid I completely failed. You were talking so quickly, I completely failed to give you a 30-second warning. Thank you very much. That's really interesting to hear, particularly working as an editor, how editors can act as gatekeepers and actually prevent progress in some of these areas if they're not careful. Thank you so much. I'm going to move on now to Manichi, please.
Thank you. I think what Aditun was saying about this is not science, that resonates so deeply with me, and the work I've done where we as researchers are so heavily focused on the methodology and how the sophistication we bring to the analysis that we often forget. And in my work in evaluations, I found the way we define impact is so narrow. We're always looking for these causal linkages. We don't think about contribution. We don't think about attribution. We think in a very linear way, especially in public health. The way our logical models or theory of changes are defined are so linear that we vaccinate, that improves outcomes, and that outcome can be measured in numbers. But we need a more participatory thinking to this, and we need to think beyond the traditional definition of subjects or beneficiaries. We need to view everybody as stakeholders and how they're actually engaged and they're contributing and to that bit of research, and more about flipping that power pyramid, that engaging with the youth, engaging with the communities. And I found that while in principle that sounds so exciting, it is so challenging to do, because how do you convince a funder that you want to engage with the communities, and the impact might not be as evident in 2 years time frame of the project. It might take time for that impact to show.
30 seconds.
Okay. The second point I wanted to stress on is the funding and the resource constraints. Unfortunately for us in the Global South, much of our development, health, climate efforts are run by developmental aid funding. And now the way this funding is constructed is also very, very narrow. It doesn't allow you much flexibility in terms of integrative research. And even if it does, it is based on frameworks that are kind of outdated. For instance, I was filling this funding application form for another, for an integrative project, but the way the application was structured and the information I had to enter was very, very restrictive. So these are some practical challenges. And then as an early career researcher who doesn't have a PhD, I feel like it is very difficult to also enter this entire discourse of integrative research, even though you bring in perspectives. I find it difficult to connect with the wider community.
Yeah, thank you very much. Interesting perspective there about how we're pushing against a kind of a regime at the moment which doesn't necessarily welcome more integrative research and isn't necessarily open to it, even if it espouses these kind of ideas. Sometimes feels like pushing a stone uphill. Thank you very much. I'm going to move on now to Donald, please.
Yeah, I really appreciate the rich discussion. And I think some of the challenges that we face with indigenous populations, particularly in the US, first of all, there's this kind of distrust of the research process and lack of diversity among the researchers. So we have a difficult time even getting to the results sometimes. So we have to work even further upstream to build out the workforce in the research community, because in American Indian populations and other marginalized groups, the messenger really matters. So I think part of our focus has to be to recognize that we need diversity in the research workforce to address these issues from a more holistic and culturally relevant perspective. So that is one of the challenges. Then another consideration, particularly for tribal populations in the US, is the idea of tribal sovereignty and data sovereignty, and that the communities own their own data. So not only do we need trusted researchers to be doing these studies, we also have to have people who can be trusted to manage the data appropriately. And I think that what's happened in some of the tribal populations is that they feel like they've been used as a laboratory to advance the careers of researchers, as opposed to being genuine partners that can have a direct benefit from the outcomes of research. So there's all kinds of challenges working with tribal populations. And I think even once we get to the publication, then how do we actually implement changes? And then there's a whole arena of political science that needs to be integrated into this. And how can we have positive impacts at the tribal, state, and national levels, and then international levels as well. So I look forward to further discussion on these important topics, because there's no simple solutions, and it's an evolving arena. But what we really need is more diversity among the researchers, among the editors, among the publishers, and the people leading these initiatives.
Thank you very much, and very well run to time. Thank you. Really interesting to hear how issues of trust and issues of people's preconceptions, I suppose, and how that influences the progress of this research area. Thank you very much. And Anna, if I can invite you to respond next, please.
Thank you. So there are persistent challenges in crossing the science policy interface. Scientists often lack training in communicating science beyond academia. And as we've heard, there are clear disincentives in academic structures to do applied and integrated research. Also a lack of awareness of policy cycles, as our colleagues have mentioned. But decision makers are also limited in their ability to engage directly with scientists, especially in the region where I work, primarily in Latin America and the Caribbean. Many countries lack clear entry points to bring science and research into the day-to-day decision-making processes. So in my other comments, I already mentioned that we are funding and training in transdisciplinary research. We believe that co-production of science, bringing together social scientists, physical scientists, community members and decision makers and others, is the most effective way to provide evidence to inform policy, despite the significant challenges with publication and career advancement that our colleagues have already mentioned. However, publishing and producing science is not enough to influence the policy sphere. So beyond the production of science, we have now launched a regional science diplomacy center, providing training and network building for governments and scientists to increase the capacity of the region to bring science to inform decision-making and policy design and implementation. One of the most successful programs is our new Science, Technology, and Policy Fellowship Program, placing early career scientists in government agencies in 14 countries of the region. And we now have our first climate and health fellows working with the Pan American Health Organization. And fellows receive training in diplomacy, communication, leadership, negotiations, and they build a rich regional cohort of science advisors in a region where that role is largely absent. So to conclude, it is important to support career pathways for scientists who want to bring their integrated research experience to spaces beyond academia, but we also need to increase the capacity of governments, communities, and the private sector to uptake this integrated science. Thank you.
Thank you very much. Yeah, I mean, that sounds like a really valuable movement in the right direction. Maybe it'd be interesting to reflect back on how that's going, and is there resistance, or does it feel like you're pushing against open doors, or does it feel like you're pushing against closed doors? But I'll come back to you on that, please, because I'd like to now move on to Renzo.
Sure. Well, my co-panelists have already mentioned and even challenged our journals on whether they are open and willing to publish a wide diversity of research articles that really show integration of different knowledge systems, methodologies, perspectives. And I would like to be more explicit in challenging the Lancet in taking the lead in publishing integrative research for its next 200 years. But also, I think, we should be asking ourselves as academics in planetary health, apart from the journals, where should we be disseminating and communicating the knowledge that we produce in the lab, in the academia, with the community? And so, for example, just a very short anecdote or example, my doctoral dissertation is half written and half in film. And the written version has only been read until today by 3 people. That's my doctoral committee. And it's still been very hard to find the right platform to publish that integrative research. but the film version has been viewed by tens of thousands of people around the world. I always show it in my speaking rounds in various universities across the world. It has been viewed by people at the World Health Organization, the United Nations, and the videos have already influenced policy and practice thinking around climate resilient health systems. So this is an encouragement for our next generation of integrative academics to harness various forms of media, of communication. In my young team in St. Luke's, everybody is trained on how to write not only a research article, but a media release, how to create videos to be able to communicate science to broader publics. And it's also important, if we want to really change the landscape of research in the next 200 years, the training must start at a very young age. You know, integrative research exposure cannot happen when they're already in the field or already in the workplace. It has to start with education, and it has already been highlighted by one of our colleagues a while ago. And it has to be connected with the communities. Everybody talks about breaking the silos. The silos exist at the high level, in the level of institutions. But when you go to the communities, the silos are perhaps even non-existent. The boundaries are blurred. The community organizations working for climate are also the ones working for health, working for nutrition, working for disaster risk reduction, for environmental protection, among others. So train and prepare the next generation and learn with the communities and maximize all the gifts of new media, digital technology. I'll stop there for now.
Thank you very much. We've got just a few minutes before we move on to the Q&A, so I wonder if I can invite the panel to sort of reflect amongst themselves on, what perhaps one of the interesting questions in this science policy interaction debate is the extent to which we can influence the policy sphere, if you like. So if this policy sphere is highly sectoral and thinking in quite narrow terms, is that and we want to change that, what are the routes, or are there routes that you've experienced that you can start to change that context? We've only got a few minutes, so I'll just invite people to speak up, please. Or maybe I need to nominate someone. Renzo, go on, let me nominate you. No?
Can you just repeat the question? I think that's why people are still thinking about
So one of the challenges, right, with the science policy interface is that we're trying to feed into a system. To some extent, we have to give, one of the ways to influence policy is to provide information in the format they already want. The problem with that is if the information they want is highly specific to certain sectors, then we've got a challenge in giving them the information they want, but also changing the system. So how might we go about doing that? Or,
Yeah, well, I'm sure my colleagues will be able to give additional, answers. I think from our side, we really need to build our capacity to be adaptive and responsive to the needs of our different audiences, whether they're policymakers at the national government. If we have very good relations with them, if we know the kinds of evidence that they're asking for, then we will be able to produce those products. But also we can have a conversation and a negotiation with them. I think it starts with a deliberation on what kinds of knowledge is needed to inform the realm of policy and practice. But if those linkages do not exist to begin with, if we do not have innate capacity to produce, for example, if a ministry requests for a video on climate and health, will we be able to produce that? Or do we have the connections with, for example, the arts and creative industry to produce those kinds of products? So it's a lot of networking and a lot of inner capacity building that's needed.
It is also using local examples and grassroots examples. Oftentimes, you see video coming from elsewhere, telling things that cannot relate to it. I think using grassroots example, going into the community, involving local knowledge, I think that is very important. Even if things are being championed globally, let us involve local knowledge. Let us have respect for local knowledge, local scientists, non-governmental organization, and let the partnership between Global North and Global South be equal partnership, not master subordinate kind of partnership. Back to you.
And just to jump in there, I think it is about an epistemological transformation that our colleagues have been talking about. This is not about academia creating knowledge and holding the expertise and pushing it out to governments and hoping that there will be uptake, because that has been the model and it hasn't worked. What we need is to sit down together as equal partners at the table at the beginning of the process, so that the priorities are identified by those who are most impacted and who will use the science, that together we co-produce the science from beginning to end. And so this is a shift in how we think about partnerships, how we work together, equitable frameworks to co-produce science.
Yeah, and I would just agree in that the data and results are very important, but it's not enough. We have to have advocacy strategies, and we have to be more skilled at addressing the political challenges that we face. I mean, it's a global issue, but we have hundreds of sovereign nations that need to be on board. So it's incumbent on all of us to identify what are going to be the best strategies to actually implement some of the changes that we're recommending based on solid research.
Thank you so much, everyone, for your thoughts on that. So we're going to move now into the Q&A section. So we're going to look through the Q&A list that registered have asked, and Margot's going to kick off with the first question, and then we'll take it in turns and direct the questions to some of our panel.
Thanks, Alistair, and everybody for the ways that the feedback is kind of riffing off each other. In that spirit, the first question we're going to go to is the one from Steffi Lowe. She asked, what do you think is the key factor for conducting integrative research on climate change and vulnerable populations compared to climate research on the general population? And I think this is a very interesting question in relation to the co-production of knowledge piece we were just leaning into there, about the ways where so often we've created a sense that different research needs to be done for what we may call vulnerable populations, an interesting phrase that we could also challenge. But sometimes it's helpful to flip it and recognize that actually research emerging from the global south and research being championed by Indigenous communities is actually exactly the kind of research that should be mainstreamed. So I'd really like to hear people's thoughts on this. There's a relationship between these challenges, but I wonder, Donald, would it be okay to start with you about that question, and then we'll move through others, and feel free to put in the chat if you'd like to respond. I'll touch on, we might not be able to get to everybody on every question. So over to you to start, Donald.
Yeah, and it is a very important question, because there are a lot of considerations when we're working with historically marginalized populations or impoverished populations. And certainly the populations I work with American Indian and Alaska Native populations, there's all kinds of historical trauma and challenges. But I think perhaps part of the strategy is to recognize that climate change is having a direct impact on traditional culture. For example, the Sundance, one of our most important traditional ceremonies, is now occurring in a much warmer climate. And I fear for the impact on traditional ceremonies.
Yeah.
In the southwestern part of the United States, in New Mexico, for example, the Pueblos have their traditional ceremonies, and it's much hotter now than it's ever been. And I think that we need to recognize that there's unique impact on unique populations from a cultural perspective. So we can't take the one-size-fits-all approach we would do globally. We have to identify those local concerns and priorities of the populations that we need to hear from.
Thanks, Donald. I wonder, it is a question I think that you've all touched on in some way, but I wonder, Manushi, if you have any thoughts particularly on this challenge in relation to the participatory and community-based work that you were mentioning, approaching this. Do we do work differently with people that have been marginalized from the research process, and or is it those people that can actually be inspiring how we conduct the work? Over to you.
I think this first part of conducting participatory research is acknowledging that it is going to be difficult, and it is very, very frustrating because, you know, as somebody had just mentioned that, I think it was Donald who said the trust that we've lost the trust of the communities. And especially when we're going in the communities, it's about that dynamic you create with them. You don't have to talk at them. You want to learn from them. And I've said this so many times that, the main output of any evaluation should be learning. It shouldn't be just the numbers. It's learning how to improve. How can we improve? We have so much that speaks about what community approaches haven't worked and what has worked, and how do you responsibly engage with these communities that you want to have the most, that should benefit from your intervention. I think one key is like trust building. Second is to also understand that, they do not face these challenges that they're facing in silos. Their challenges they're facing are interrelated. Mm-hmm. I might have gone in for a WASH study, but then I found out how it's linked to poverty, how it's linked to gender-based violence, how it's linked to so many other factors. While we are not able to address that, it is very necessary that these things are brought out through our research. And also, like in my work, I've tried to work with community champions. You go identify who are the champions in the communities, and women-led self-help groups do an amazing job of knowing what is the situation with each household and how that neighborhood upliftment plan can be carried out. And when I'm saying communities, it has to go to the very cellular level. It can be, you can do it with the youth. And youth has, to be honest, most of the climate change movement is led by the youth. The time now is to engage them responsibly in the research, in the policy, in the implementation. We have to learn from these youth movements. They've taken such an amazing role in the activism, but it's time to give them a platform to evolve further.
And I would love to hear everybody's response to this one, but I'll hand over to Alistair to get on to another question, and we'll come back to some others.
Thank you. This will probably be the last question, realistically, just because of timing. So Jacob Koya has responded to Renzo's point about kind of digital media, if you like, and one of the questions, perhaps they offer an opportunity for us to kind of leapfrog some of the conventional barriers to sharing information. So I would just be interested in the panel's perspective on, how that's effective, but maybe also whether perhaps it's hard to tell. In a number of views, it might be hard to tell if that means it's being impactful. But I'd be interested in your reflections on how these kind of new digital media might create opportunities to influence these kind of more integrative perspectives on the world. Let's start with Anna, if you are okay.
I guess my answer is just yes. Yes, art, communication, any channels that can communicate beyond a traditional journal will have, by its very nature, a broader impact on reaching communities, decision makers, and others who want and need to use this information. So I think it's a fantastic opportunity, allows us to reach many people at a large scale through social media channels and beyond. So we, from the academic and other sectors, really need to work more closely with the arts and the creative communities and our colleagues who do work on social platforms. It's a critical need, and I think we would be remiss if we didn't invest heavily in communications in all of our organizations, which often does not happen.
And the reason I picked on you is because I recall that you run a massive online course, right, on that's a way of promoting some of these ideas. So yeah, that's another really interesting kind of way, or there's perhaps more in depth than you often get with the Twitters or the YouTubes kind of interactions. How have you found that?
Well, I was just going to say briefly, the large virtual courses are a fabulous way to reach so many people with very low cost, but it doesn't replace the in-person engagement. So these huge courses are, again, great to get the information out. We right now are running a course on El Nino and health in the Americas, and we've had, more than 1,000 people connecting live twice a week for these courses presented by experts. But also, if you want to really build teams, you have to have and create funding for the spaces of in-person engagement. So this hybrid modality, I think that's a gift of the pandemic that pushes us to be able to work in these different ways together to move forward really important agendas at a global scale.
Thank you. Before we quit, Adatun, I wondered if you had a perspective on kind of new media and whether that is something that's been useful in your work or progressing that integrative agenda in your context.
Okay, so there is this concern about maternal and child health in Nigeria. There's been statistics that has been churned out in various media about maternal deaths, women dying during childbirth. But we have a very creative Nollywood industry, and recently they put out a clip that translates the statistics into like having a plane full of pregnant women dying monthly. And that resonates a lot with people who will not be able to interpret the statistics. So for me, it is something important that we do. But like I've mentioned earlier, it has to be speaking the language of the community, of the population you are talking to, and building on local knowledge and using local examples. But even though we know this is something we should do, but like the issue is about funding. What part of the funding is available to say you want to produce a video as part of your work for communication? And that speaks to our funding organization being flexible, realizing that it's not just publishing in a journal. We need to be able to produce this to communicate with our audience and people that will use our knowledge. Back to you.
Thank you so much. I think we're running a little bit short on time, so I'm going to pass over to Margot, who's going to invite you to kind of finish with well, I'll pass over to Margot. She'll do that.
Thanks so much. We wanted to give people that last take-home message, especially for early career researchers. We've got over 200 people online here. There will be some of these young folks who are like, do I have the courage? These guys are amazing. Can I do it? So that 30-second message, and because we didn't get to you earlier, I'm going to start with you, Renzo, your 30-second take-home message, and then we'll do a lap around the group.
Sure. Well, integrative research is here to stay because our problems are deeply integrated. And so I encourage the next gen, grab it, it's yours, and own it and shape it and remold it. And also, in terms of the use of new media, maybe there are concerns about, that's not where the incentives are in academia. That's not how we're measured in terms of our academic progress and achievement. But remember, the climate crisis has a deadline. It's 2030. Now it's 2027, according to some scientists. And if the knowledge that we create is very needed now, if we need to release it through a film, through dance, through an op-ed, etc., we should do it. It's about the objective of the research that we do. Thank you.
Thanks so much, Renzo. Round to you, Adatun, for your final take-home message.
My take-home message is for us to realize that the world is unequal. The starting point and the issues we grapple with in terms of climate change, in terms of development in global south and in global north are different. So we need to put in the context. Context is very important to be able to know that what we're doing is actually solving a problem for the population that is at risk. And no one cap fits all. Let us meet everyone where they're starting from.
That's great. Thanks, Adatun. Manushi, I'm coming around to you.
Yes, I'm very excited to see this appetite for integrative research because I remember when in my 5 years back, I just had a lot of questions and there was nobody to address them. And that's how I actually started out, by just asking these questions, by posting these questions. And as an early career researcher, that's what helped me grow in this field. And my final message is that it's an all hands on deck situation. So whatever you can contribute in whichever manner, and don't restrict yourself. Maybe today you're making videos, but tomorrow you might be writing a journal op-ed. It's all possible.
Thanks, Manushi. I'm loving this emphasis on courage and tenacity. Anna, round to you.
Hello?
Hi. Oh, we just lost Anna. I'll come round to Donald first. Oh, there you are, Anna. Go ahead. Go ahead.
Okay. Wait, so by its very nature, integrative research is rooted in local contexts, as we've heard, with local communities and decision makers. So as a result, language matters. The global dominance of English language in scientific publications is resulting in the exclusion of scientists and science policy leaders from the global south. So what can we do? Invest in interpretation costs, use AI, and create multilingual, high impact, open access publication platforms to counter the assumption that English is the default language of science, and this will radically change who drives the science and policy priorities and the solutions that emerge.
Great stuff, Anna. Thank you. And round to you, Donald.
It is two quick final thoughts. Is that one, we do need more diversity within the research workforce, but we also need allies, particularly from an Indigenous perspective. We need non-Indigenous allies, but people who can actually engage the community in a meaningful way and build champions within the communities that we're trying to connect with. And then finally, the research does not end at the publication. Like what we're saying, we have to have better dissemination of the information to other sectors, policymakers, political leaders, community leaders. So we can't have a one-size-fits-all approach to how we're communicating our results. So thank you so much.
That's great, Donald. As a long-standing integrative researcher and learner, I'm really inspired by you all. Thanks, and over to you, Alistair.
So thank you very much. So that it just really falls to me to thank the panel for making time, because I know that you're all very busy people, and it's just been an absolute pleasure to be involved in this. So thank you very much. And I'd just like to finish by saying this isn't a kind of a one-off interest that we have at the Lancet in integrative research, and this is very much a direction of travel, particularly at Lancet Planetary Health, because planetary health is intrinsically very much an integrative endeavour. But hopefully watch this space. There'll be more opportunities to have discussions about this kind of work going forward. And just once again, thank you very much. Thank you so much, Margot, for your assistance as well. It's very much appreciated. And,
pleasure. Thanks, everyone.
Thank you. And until next time.
Bye.
Bye.